In this video, we'll discuss about fibrin degradation product. First, introduction, normal hemostasis. The mechanism by which bleeding from an injured vessel is arrested by formation of a thrombus. So bleeding from an injured vessels is arrested by formation of thrombus. What are the function? To maintain the blood fluid state, to prevent clot in intact vessels, to arrest bleeding in injured vessels. So these are the three important functions. Next one is components are blood vessels, platelet, plasma coagulation factor, fibrinolytic system. Then normal hemostasis. This is the flow chart shows normal hemostasis. Injured to vessel wall. So injury to the vessel wall leads to construction of blood vessels, which leads to formation of temporary hemostatic plaques. It also to the exposure of collagen, which can causes platelet reaction and leads to loose platelet aggregation, which in turn leads to formation of temporary hemostatic plaque. It also leads to tissue thromboplastin, which leads to the activation of coagulation and the formation of thrombin, which in turn leads to a definitive homeostatic plaque. So this is the flow chart of normal hemostasis. It takes place in three steps: tethering, activation and stable addition, and spreading and aggregation. So three steps: tethering, activation and stable addition, spreading and aggregation. Coming to stages, it have two stages, primary and secondary. The primary stage, injury to the vessel wall, which causes platelet reaction, then leads to the loose platelet aggregation and the formation of the platelet plaque. In this secondary stage, activation of plasma coagulation factor and formation of stable fibrin clot, then dissolution of fibrin clot by fibrinolysis. So it having primary and secondary stage. Primary stage, formation of platelet plaque. Secondary stage, dissolution of fibrin clot by fibrinolysis. So coming to stages of hemostasis, in this primary state, platelet and vessel wall mediated. It occurs within a second of injury. It form platelet plaque, prevent blood loss from capillary arterioles and venules. In that secondary one, the coagulation factor mediator, and it takes several minutes for completions, then form stable fibrin plaque, then it prevent blood loss from large vessels. So platelet and vessel wall mediated, this one is the primary one. Coagulation factor mediated is the secondary one. Within a second will occur, several minutes it takes. Here form platelet plaque, here fibrin. Here prevent blood loss from capillary arterioles, here blood loss from large vessels. Fibrinolysis, that plasmalogen is converted into plasmin by plasminogen activators. They are kallikrein, factor 12A, tissue plasmalogen activator, then urinokinase and streptokinase. These are the things plasmalogen activator. Plasmalogen is converted into plasmin. Then this causes degradation of fibrin to fibrin degradation product D dimer. So this one will converted fibrin to fibrin degradation product D dimer, which has inhibitory effect on clot formation. So plasmalogen into plasmin with the help of plasmalogen activator. Then this one causes degradation of fibrin to fibrin degradation product, then which has inhibitory effect on clot formation. The fibrinolytic system is activated in response to activation of coagulation cascade. This system functions to remove fibrin from the vascular system in a controlled manner. Once it has fulfilled its functions and to prevent excessive fibrin accumulation. This system which digit the fibrin clot through proteolysis must be regulated so that proteolytic activity is limited to the area of fibrin formation and does not occur prior to healing of the vascular lesion. Then formation of fibrin. The insoluble fibrin clot is formed from soluble fibrinogen in three steps. One is proteolytic cleavage of arginine glycine bond by thrombin, releasing fibrinopectin A and B from the chain and forming fibrin monomer. Second one is spontaneous polymerization of fibrin monomers to form fibrin polymers. Third step, stabilization of fibrin polymers by factor 13A catalyzed cross-linking. Fibrin formation occurs both intravascularly and extravascularly as a consequence of coagulation, inflammation, and tissue repair. When no longer needed, fibrin must be removed. No longer needed, fibrin removed so that normal vessel and tissue structure and function can be restored. The process of removing fibrin is called as fibrinolysis. So no longer needed, that fibrin must be removed. That process name is called as fibrinolysis. Fibrinolytic system is responsible for dissolving thrombi and maintaining a patent vascular system. Fibrinolytic system is responsible for dissolving thrombi and maintaining a potent vascular system. Next one is the key component in this system. What are the key component presented? Inactive proenzyme plasminogen, then plasminogen activator, then that active enzyme plasmin, then fibrin, then fibrinogen degradation product and inhibitor of plasmalogen activator and plasmin. These are the key component presented in this system. Fibrinogen. The fibrinogen molecule is large trinodular glycoprotein found in plasma. This one is the trinodular glycoprotein presented in plasma and platelet alpha G. Megakaryocytes and platelet does not synthesize the protein but absorbed from its plasma. Fibrinogen is the most abundant coagulation protein with a plasma concentration of 2 to 4 mg per ml, representing about 2% of total plasma protein concentration. Then fibrinogen is encoded by three separate genes located on chromosome 4, and the production of 3 chain is coordinately regulated. Fibrinogen is also one of the several hepatic protein whose production is increased as part of acute phase response mediated by interleukin 6. Structure of fibrinogen. It is a trinodular structure composed of three phases: alpha, A alpha, B beta, and gamma. A alpha, B beta, and gamma, and disulfide bond, polypeptide chain. These are the things: disulfide bond, polypeptide chain. The central nodule is known as E domain. Thrombin claves here. Thrombin claves small peptide, the A alpha B beta chain in this region, forming fibrin. The central nodule is joined by supernodules alpha helix, the terminal nodules D domain. So E domain, D domain. So this one is the trinodular structure, three phase A alpha B beta gamma, disulfide bond polypeptide chain, central nodules E domain. This one is the terminal D domain. This central nodule, the thrombin claves small peptide A alpha B beta in this region, forming fibrin. Release of FBA and B. Thrombin bind to central E domain of fibrinogen and claves specific arginine glycine bond, releasing 4 peptide from the fibrinogen molecule. So thrombin bind to central D domain of fibrinogen and claves specific arginine glycine bond, releasing 4 peptide from the fibrinogen molecules. It releases a short peptide containing 16 amino acid from each A chain, as well as 14 amino acid peptide from each B chain. The resulting molecule is called as fibrin monomer. The release of FBA alone is sufficient for the fibrin assembly process. Assembly of fibrin polymer. The cleavage of FBA and FBB exposes binding site in the central E domain that interact with the complementary site on the gamma chain of the D domain of other fibrin monomers, creating DE contact. The polymerization site on the D domain are always available and interact with the complementary site on E domain after thrombin cleavage. The polymerization continue by the addition of the third monomer, forming DD contact as well as another DE contact. The use of X-ray crystallography to study fibrinogen has provided insight into the mechanism by which fibrin self-assembly. The crystal structures show the mechanism for electrostatic steering to guide the alignment of fibrin polymer during polymerization. The non-covalent interaction of the nodules leads to initial formation of two-structure polymer termed protofibrils.